The human immunodeficiency virus is the virus that causes HIV disease. Currently, anyone infected with HIV, regardless of the stage of his or her disease, is considered to have an HIV infection. In adults, the illness is then categorized into one of three different stages on the basis of their CD4 plus lymphocyte count, CD4 plus percentage of total lymphocytes, or the presence or absence of certain infections commonly found in individuals with compromised immune systems. HIV-infected individuals who do not receive treatment usually have a lifespan of about 12 years from diagnosis of HIV disease. In stage 1 of an HIV infection, the CD4 plus count is at least 500 cells per microliter, and there are no AIDS-defining conditions. In stage 2, the CD4 plus count is between 200 and 499 cells per microliter, and again, no AIDS-defining condition. Stage 3, or AIDS, is when the CD4 plus count is less than 200 cells per microliter and or there's an AIDS-defining condition diagnosed. In 2010, the UN Program on HIV/AIDS estimated that 2.6 million people are newly infected with HIV yearly worldwide. There has been a decrease in the number of deaths and an increase in people living longer with HIV. In fact, the life expectancy of a person diagnosed with HIV at age 20 and taking current HIV medicines is approaching that of a person who is not infected with HIV. HIV transmission occurs through sexual intercourse with an infected partner, exposure to HIV-infected blood or blood products, and perinatal transmission during pregnancy, at delivery, or through breastfeeding. Unprotected sex with an HIV-infected partner is the most common mode of transmission of HIV. Presence of genital sores or other sexually transmitted diseases increase the risk of transmission. IV drug use and sharing of paraphernalia is a high-risk behavior as well. CDC data collection on the incidence of HIV in the United States indicates that the majority of cases are the result of male-to-male sexual contact, with heterosexual contact and IV drug use lesser causes of transmission. The CDC states that in 2010, the highest rate of new infections among different racial and ethnic groups was in African American men, especially men who were having sex with men. HIV-positive mothers can pass on the virus to their children through pregnancy, labor and delivery, or breastfeeding. Risk factors for transmission in children and teens other than perinatal transmission include exposure to blood products or body fluids that contain HIV, sexual abuse, risky behaviors including IV drug use and unprotected sex, having other sexually transmitted infections, and lack of awareness of HIV. Under normal situations, the human body's immune system protects it by recognizing and destroying invaders such as infectious diseases, abnormal cells, and foreign objects. However, when someone is infected with HIV, the immune system functions are compromised and it makes the individual more susceptible to different infections. Once inside the body, HIV attacks the CD4 plus T lymphocytes. The role of the CD4 positive T lymphocytes is to fight infection. HIV attacks the very cells meant to protect us against infections. HIV disease begins with viral transmission, seroconversion, and acute viral infection. When a person is first infected with HIV, the virus causes an inflammatory reaction, bringing white blood cells and macrophages to the site of the inoculation with the virus. During this time of acute viral infection, the individual may manifest symptoms of a flu-like viral illness, low-grade fever, generalized aches and pains, swollen lymph nodes, and generally feeling ill. After several weeks, the person's immune system develops antibodies to HIV and seroconversion occurs. The patient will now test positive for HIV. After an acute viral infection, there's an asymptomatic chronic infection, where the immune system begins to exert control but is not able to eliminate completely viral replication of the HIV virus. The CD4 count increases to near normal, and the viral load level drops to a set point. This set point occurs when the replication is still taking place, but the immune system is able to destroy the virus in equal amounts as it is being produced. Symptomatic chronic infection occurs as the CD4 count eventually continues to fall, and control over the viral replication process is slowly lost. The immune system becomes less able to fight off infections, and individuals begin to develop nonspecific symptoms, such as more frequent respiratory tract infections, skin problems, enlarged lymph nodes, and weight loss. Then HIV disease progresses to acquired immune deficiency syndrome, or AIDS. And this is when the immune system is less and less able to fight off infections, and you have the appearance of opportunistic infections. These AIDS-defining conditions will eventually result in death. So the illustration on the screen shows you the life cycle of the HIV virus, how it attaches to the CD4 cells, inserts itself, replicates itself, and then will bud off and create new HIV virus cells that will circulate. Clinical manifestations observed in the patient with HIV/AIDS are most often related to the impaired immune function and are typically a reflection of the opportunistic infections that occur as a result of HIV disease. An HIV-infected individual has AIDS when the CD4 count is less than 200 cells per microliter, or when he or she is diagnosed with one or more age-defining illnesses. The diagnosis of HIV is usually made with screening tests followed with confirmatory testing. Rapid tests utilizing blood or oral fluids can be used in settings where a quick answer for the presence or absence of HIV antibodies is required, such as in health screening, occupational exposure, or labor and delivery. The results from the rapid tests are available in 5 to 30 minutes depending on the test used. Another screening tool is the ELISA screening test. This test requires a blood sample which must be sent to a laboratory for testing. Results are available in 24 to 48 hours. A positive screening test requires confirmation by an HIV Western blot. The HIV Western blot blood test confirms the presence of proteins unique to the HIV virus. If the proteins are absent, the person is not infected with HIV. A positive screening test followed by a confirmatory Western blot is used to diagnose HIV in all individuals over the age of 12 months. HIV PCR is used to detect HIV in infants born to HIV positive mothers because the screening test tests antibodies and these transfer across the placenta. So if you tested for HIV antibodies, the infant could test positive because of the presence of the maternal antibodies. HIV PCR is a virologic test that directly detects the HIV virus. HIV drug therapy includes prophylaxis to reduce the risk of opportunistic infections such as toxoplasmosis and PCP or pneumocystis carinii pneumonia before initiating antiretroviral therapy. Current Department of Health and Human Services recommendations for initiating antiretroviral therapy state that it should be considered for all HIV positive individuals, regardless of CD4 count. Antiretrovirals interfere with the ability of HIV to reproduce itself. Highly active antiretroviral therapy, or HAART, is most frequently prescribed now, and this is when the HIV positive individual is prescribed a minimum of 3 drugs from at least 2 different classes of HIV medicines. Some newer medications, called combination HIV drugs, contain 2 or more HIV medicines from 1 or more drug classes in one tablet, making it easier for compliance with ART regimens. HIV positive individuals should also maintain updated influenza, pneumonia, and Tdap vaccinations. They should not receive live virus vaccines, nor should the members of their household, due to the HIV positive individual's compromised immune system. HIV cannot be cured, but ART can delay disease progression by decreasing viral replication. When taken consistently and correctly, ART can reduce viral loads by 90 to 99%, which makes adherence to treatment regimens extremely important. The major advantage of using drugs from different classes is that combination therapy can inhibit viral replication in several different ways, making it more difficult for the virus to recover and decreasing the likelihood of drug resistance. A major problem with most drugs used in ART is that resistance develops rapidly when they are used alone or taken in inadequate doses. Thus, combinations of 3 or more should be used. Antiretroviral therapy is designed to attack the cell replication process at various points. And there's certain classes of drugs that attack at the entry to the cell. Others attack when the virus is changing from its RNA form to its DNA form, and so forth. There are many medications out there now that will attack the replication process at some point. Please read through the table from your text included on the slide that covers the different classes of drugs and their mechanism of action. Prevention of HIV infection means education about the basic facts about HIV transmission, risk factors, risky behaviors, the need for testing. Current recommendations state that all providers should offer routine screening for HIV for all individuals between the ages of 15 and 65. In HIV-negative individuals, yearly testing is recommended for those at high risk. Caring for the client with HIV/AIDS requires collaborative care. On the initial patient visit, you gather baseline data, you begin to establish a rapport, and use patient input to develop a plan of care. Initiate teaching about the spectrum of HIV, about treatment, preventing transmission, improving health, and family planning. Collaborative care will also include monitoring disease progression, monitoring immune function, and managing symptoms. In caring for clients with HIV infection, nurses should utilize universal precautions consistently. ART regimen medications should be administered as prescribed and on time. Provide nutritionally dense foods and small, frequent meals. Provide emotional support and refer for social services evaluation. Patient education is another nurse priority. You want to instruct the HIV positive individual to avoid high-risk behaviors that increase the risk of transmitting the disease to someone else. Stress adherence to the treatment regimen. Make sure they get follow-up testing on CD4 and HIV viral load blood levels to monitor disease progression. They should implement infection control precautions at home, like having someone else empty the cat litter box so they aren't possibly exposed to toxoplasmosis. Clients with HIV also need to be aware of the signs and symptoms to report to the healthcare provider urgently. I have tried to capture all of the main points about HIV disease in this voiceover. If you have any questions, please contact me. Email is always the best. Thank you and see you in class.